This video is a quick introduction to the proper positioning for a finger radiograph, PA, oblique, and lateral views. In order to successfully accomplish this examination, we will be utilizing an 8x10 image receptor placed portrait on top of the tabletop with a source to image distance of 40 inches. Let's go ahead and have our instructors demonstrate how this examination should take place. Begin with the patient being seated at the end of the table and a lead apron being placed upon his or her lap. Have the patient place his or her hand in the PA position so that it lays flat against the image receptor. Pronate hand with fingers extended and center and align the long axis of the effective finger with the long axis of the image receptor. Separate any adjoining fingers from the affected finger. As you can see, we will be utilizing the second digit for the purpose of these examinations. Go ahead and place the letter marker in the medial part of the body within the light field. The center ray should be perpendicular to the image receptor and at the level of the PIP joint to include the distal metacarpal. There should be no angulation on the tube, and in order to obtain this image, instruct the patient to remain still and not move. While observing the patient, obtain the exposure. Once the X-ray has been taken, instruct the patient to relax, enter the room, and remove the image receptor from the examination room. Go ahead and process the image receptor to acquire the radiographic image. Enter the room with a new image receptor in order to continue to the oblique view. In order to attain the oblique view, you will have the patient rotate his or her finger 45 degrees from the current position. In order to do this, you will position the hand on the image receptor so that the long axis of the finger is aligned with the long axis of the image receptor. For the purpose of the second digit, you will do a medial oblique as demonstrated in this video. But for the purpose of the third through the fifth digits, you will have a lateral oblique. Ensure that the center ray is perpendicular to the image receptor at the level of the PIP joint and that it is also including the distal metacarpal. There should be no angulation of the tube, and the marker should be placed medial to the body part within the light field. In order to obtain the image, instruct the patient to remain still and acquire the image while observing the patient. Once the X-ray has taken place, instruct the patient to relax, enter the room, and remove the image receptor from the table. Go ahead and process the image receptor in order to acquire the radiographic image. You may enter the room with the new image receptor in order to acquire your final view, which should be your lateral view of the finger. In order to obtain this view, you will have the patient rotate his or her hand so that the finger is lying in a truly lateral position when extended. The second digit should be taken in a medial lateral position with the thumb side down as demonstrated by this video. The third and fifth digits should be taken with the lateral medial position. The center ray should be perpendicular to the image receptor and at the level of the PIP joint to include the distal metacarpal. There should be no angulation of the tube, and the letter marker should have been placed medial to the body part within the light field. In each one of these views, you want to make sure that you collimate to the finger in question. So therefore, you should not be taking a image of the entire hand, but rather just of the finger that is being radiographed, be that the first, second, third, fourth, or fifth digit. In order to obtain the image, once again, instruct the patient to remain still while you make the exposure observing the patient. After the exposure has been made, instruct the patient to relax while you enter the room and remove the image receptor in order to process it through the processor to acquire the radiographic image. Now that you have done this, you have completed the PA, oblique, and lateral views of fingers. Let's go ahead and demonstrate what a proper radiograph of these views should look like. Here we have a PA position of a second digit finger. You should be able to see the proximal phalanx as well as the PIP joint, a middle phalanx as well as the DIP joint, and you should also have the distal phalanx. The oblique view of the finger will demonstrate the same exact anatomy but at a 45-degree angle. Finally, the lateral view of this finger should demonstrate the proximal phalanx, the middle phalanx, and the distal phalanx in a truly lateral position. Keep in mind that this examination is for the second digit. It will obviously alter if you were taking the third, fourth, or fifth digit. This concludes the quick introduction to the proper positioning for a finger radiograph.